program where we interact with honorable commissioners of Imo State, where they tell us what they have done so far in the various ministries, the achievements of His Excellency, Distinguished Senator Hope Uzodimma. And currently we are in the office of the Honorable Commissioner for Health. And I'm not here alone. I have with me
Lulu Vincent, correspondent to Daily Independent Newspapers.
Stand Uzaru, Imo State correspondent, Daily Sun Newspapers.
John Kennedy Zoma of the Nigerian Tribune Newspapers.
Victor Wachuku of the News Agency of Nigeria.
I'm treasurer in H1. She's also a journalist, a senior colleague. Assistant PRO. May we meet you, sir?
You've met me. My name is Success, Prosper-Ohayagha. I am, by the grace of God, the Commissioner for Health, Imo State, steering the ship of the Imo State Ministry of Health in the 3R government of His Excellency Distinguished Senator Hope Uzodimma. Prior to now, I was the board chairman of the Imo State Specialist Hospital, Owerri, which we all know how it was prior to the coming of His Excellency the Governor and what it is now. And I was also a key player during the pandemic in 2020-2021, the COVID-19 pandemic. I was a member of the Imo State COVID-19 Task Force, and also I was the chairman of surveillance for the task force and the chairman of resource mobilization for the task force. So I am Success, Prosper-Ohayagha.
What is your background? Are you a doctor, and how long have you been a doctor, your experiences and all that?
Okay, I've been a doctor for over 20 years. I'm a medical doctor. I am a specialist in reproductive health. I have a background in public health. I also have a background in general insurance and health insurance. I'm actually a fellow of the Institute of Health Insurance and Managed Care of Nigeria. I am a fellow of the Institute of Management Consultants, and I have a master's in international public health, and by the grace of God, a fellow of the Royal College of Obstetricians and Gynecology in Edinburgh.
Well, the reason why I asked for your background is so that I can know how to come in. So the expectation from you prior to your background is high. What are the health policies so far you have initiated?
Okay, very much we know that one of the basic things we need to do is the universal health coverage. And the universal health coverage actually has to do with healthcare financing. What are we talking about? We're actually going to be talking about health insurance. Why are we talking about this? You know, prior to the invent of health insurance, the very poor people would die because they didn't have the money to go to the hospitals. Or even if they had to go to hospitals, they would be looking for hospitals they could afford, and then they will be treated shabbily. But with health insurance, what we're talking about is that everybody, irrespective of your social strata, your class, can go to the same hospital and access health care the normal way it should be. So with His Excellency coming in, the state actually had the Imo State Health Insurance Agency, and at a stage it looked like almost moribund, looking like it wasn't going to function, looking like it was a scam, and nothing was moving. So we sat down, coming in as Commissioner for Health, with His Excellency, who also understands the reason why we would need the health insurance, because the truth of the matter is that this government thinks about what we touch the grassroots, and for me it is not about what you're going to get as a commissioner. It is what legacy are you going to leave after you have left this office. And we are talking about how will it touch our people? How will my aunt, who is back there in the village, who is old, yes, I might give her something, but how will she, at the stage where she cannot afford to reach me, get to the hospital in Amiibo and get treated even with her money? But we sat down and talked about health insurance, and the SNSC understood why we needed to do that. If you check the Sustainable Development Goal 3, Target 8, it talked about everybody being able to afford health care. And equitability is part of it. And that was why we rolled out the health insurance policy. And by the grace of God, on the 4th of May, His Excellency officially flagged off the Basic Healthcare Provision Fund, which will take care of the vulnerable groups and the under 5 children and pregnant women in our rural areas. And also the formal sector health insurance coverage, which would give health insurance to the civil servants. The civil servants, when we're talking about civil servants, we're not just talking about those in the state civil service alone, we're also talking about the local government civil service commission, staff. And with that was flagged off. What stage are we in now? We are at the stage at which the premium will be deducted. But in his own magnanimity, I must say this, he has said that for the first 1 year, that the government will bankroll this. They are not going to take off this premium. Okay. You're going to ask me, how do you mean? The government has said yes, they are going to pay 15,000 naira per head of everybody that is working with the states. Okay. For the first 1 year, and then that will help us test run our health insurance properly and then move it. Once that is done, we can now sit down and say, oh, 15,000 naira, divide it by 12 months, we know how much it will be per month, and each month we might look at it and say, okay, let us start removing this 1,000 from the salaries of staff. Okay. After this has happened, we will now start looking at staff, because if you are well and your family is not well, you are not well.
That's correct.
That is the truth. We start looking at covering the dependents. And once we cover the dependents, we have actually achieved a very good coverage for the family. Now, when these children, these dependents and the husband and everybody, the children especially, who are below 18 years will be covered. Then the question will be, what will happen to those who are above 18 years? They are, under normal circumstances, they are supposed to be in the university when things are done well. So when they get into the university, we have the tertiary institution health insurance program. Okay. That's called the T-SHIP. That will cover them. And as they are coming out of the university, they are going to youth service. And there is a health insurance scheme for corpers that covers the whole youth corpers in the country. And then they get in there. And by the time they come out, they get into the workforce and get back. So it's a cycle. It's a continuous cycle. And that's the way in chemistry we say under standard temperature and pressure, if everything remains same, that's the way it ought to roll and get in. Yeah.
Okay, sir. Tentatively, I know that all the hospitals in Imo State, you supervise them as a commissioner. Can you give us an idea of how many hospitals we have in Imo State, both government-owned and private? Do you have a way of regulating them, checking, running a check on them, and all that?
Okay. Funny enough, before you came in, I was signing some of this thing. If you see on my table, you're going to see some files, okay. And just this file here is folio number 3097. So we have far above this number registered in Imo State.
Okay.
Now, every year we have a database that check the hospitals and see that they are up to date.
Okay.
When they pay their registration, there is something called re-accreditation.
Okay.
The inspection team, headed by the Director of Medical Services, would go back, because it's a must. Once you don't re-register and pay your practicing license and your registration license, you are working out of place. It's illegal. So when they go, checking from their data, the number of people that have registered, then they now fix a date to go check, and then we start clamping down on those. Usually we do this through, because for every medical doctor you are supposed to be a member of the Nigerian Medical Association.
Okay.
So we do this through the Nigerian Medical Association, because we also need to know your practicing license if it's up to date. And just like it will be, sometime last week, we had to go to a certain hospital in Okigwe to inspect, because we had reports, even from Nigerian Medical Association. We do what's called case management, and to quality of care, which is most important. So we picked doctors from different departments in this ministry who went to Okigwe, did their due diligence, and they have come up with their reports. That report will be sent to Nigerian Medical Association Okigwe and to the state Nigerian Medical Association to say, yes, we have looked at this doctor, these were our findings, and these are our recommendations, and these are actually, because we are the regulating body, so if we need to sanction, we sanction. If we need to give kudos, we give kudos. Because if you sanction without giving kudos to those that are doing well, you discourage them.
That's correct.
So we have our ways of checkmating them, not just hospitals.
Clinics.
Hospitals, pharmacies, medical labs, mortuaries, maternity homes, patent medicine sellers are under us. Trado medicals.
Chemicals. Chemists.
Yes, those are departmental. So you have the trado medical practitioners, so that they are under the right regulation. This is very important because of medical legal issues that will come up. If you don't have proper coverage, you're not registered with the ministry, anybody that takes you to court and finds out all these things will hit you hard.
So how many hospitals are registered with the ministry? Correct.
Yeah, like I told you, we have far above 5,000.
5,000.
Yes, far above, because if you have,
owned and private.
yeah, both government owned, because when you talk about the government owned hospitals, we have about 19 general hospitals in the states.
Where are they situated?
In the local governments.
In the local government.
Yes. We have in Aronde Zogo.
Okay.
We have in...
Functional.
Yes, I'm calling the functional ones. We have in Ngopala.
Okay.
We have in Our Mama.
Okay.
There are so many of them under the hospital management board. So we have these general hospitals there. Then you also look at which other hospitals, our tertiary hospitals. We have the Imo State Specialist Hospital, and then we have the Imo State University Teaching Hospital, all functional. Actually, I was at the Imo State University Teaching Hospital 2 weeks ago. We were all there. We went around. Even the medical students were having their final exams, and they were happy seeing me around, because at that point when they were having their exams, and I saw some of their examiners, I was like, "Hi, you're handling our students. Please make sure they are doing." And they were very happy. Nothing encourages our students like seeing their senior colleagues, because for me, whether you're a student a doctor, one day you become a doctor, and so we are colleagues. So seeing your senior colleague coming in to say all the best. And I'm happy to say that the teaching hospital, since the inception of His Excellency the Governor, has done well in bringing out new graduates from the medical school.
Okay.
Actually, this last one is our 5th set.
From the Imo State University.
From Imo State University Teaching Hospital.
Wow.
Since the governor came.
What magic did the governor do that led to the graduation of our medical students? Because I know that some stayed 15 years.
About 10, 11 years.
Okay.
10, 11 years.
11 years.
Yes.
Without being graduated. So I've been thinking, what is this magic that the governor did?
The question you're going
What
to ask
held them
yourself,
back all the
the
way?
question you're going to ask yourself is, for you to be where you are, somebody made the environment conducive.
Okay.
There are certain things that are needed
In the hospital.
for a medical school to go ahead, and that is why the accreditation should be given. At times, I'm not in the habit of running down administrations, but I'm in the habit of saying what the administration that I am in is doing. His Excellency came in. One, you must have the spirit of a father to be able to feel the pain of your children. For God so loved the world that He gave His only begotten Son, because He was our Father. And He felt our pain that we were in sin. So He gave us His only begotten Son to save us. And so for God so loved Imo State and our medical students that He gave us hope, to save our medical students. So He came in, saw all the rots, saw all the needs, saw everything that the Medical and Dental Council of Nigeria had requested the state to do. He plunged in, one, made the road accessible, modernized the place, put in lots of money to put in equipment in there, and then paid the accreditation fees that were needed. And you know, the truth of the matter is that we must say what had happened. No politicking about this. This is verifiable facts. So I am not going to be doing anything
You are saying that the past government, being that of Rochas, he did not pay the accreditation fee, he did not equip the hospital and all that. So that was what held back our students.
I didn't say that. Maybe you are putting that into my mouth. But I'm just telling you that these were the things we saw.
Okay, that held back the students from...
So anything that must have held back the students, we saw those things and His Excellency cleared them. And then we started. We brought in lecturers. Professor Bond Anyehe was brought in to be acting provost as at then, and he did so very well in helping us galvanize through. Until today, they are moving well. The present provost, Professor Guregu, the CMD, Professor Ifeanyi Nwamba, and the lecturers, I can mention lots of them who are in surgery. You have Dr. Kaunda, the neurosurgeon, going there. In O&G, you have the Commissioner for Health Insurance, Dr. Batlomi Okorochukwu, going there. You have our ES, Primary Healthcare, going there. You know, giving their bests, because they all have the flair for teaching, and they are giving their best to our students and making sure our students are all doing well. So I think it's not a one-man thing, it's a collective thing. And like I would always say, a driver with a good driver's license, certified driver's license, is on board. Okay. And he's leading us, and that's why we are moving.
Okay, so I want to go to grassroots. Our people in the villages, how do they access healthcare? what is the state of our primary health care currently? Because I know that over the years, our primary health care have been moribund, forgotten, and all that. You have said that the governor is a health-friendly man. How far has he touched the primary health care in Imo State? What is the current status of our primary health care in Imo State?
Okay, thank you. I'll start by saying, you know the triangle, you know the shape of a triangle.
That's correct.
The base is wider down, and the apex is slimmer. Not only in Imo State. This pyramid I have just explained to you as a triangle. Apex is supposed to be tertiary. The middle is supposed to be secondary. And the base is supposed to be primary. So what it actually means generally is that for every healthcare, you start from the primary. When they cannot access care, they go to secondary and from there to tertiary. But in the country generally, everybody now, because you have one brother that is a doctor in the teaching hospital, ordinary malaria, he will tell you, come to the teaching hospital.
Exactly.
So now we had what we call inverted pyramid. That inverted pyramid now made the base wider at the tertiary end, the secondary still having its size, and then the primary thinning out. Because most people, when even in the village, when you tell them go to the primary health center, go to their health center near you, they will say, no, we will not go. Let's go to Mbaroku. Mbaroku is where the secondary care is in my village. No, we will not go to health center, we'll go to Mbaroku. So everybody is running away from the health center. What did we do when we came in? We realized there was rot.
In the primary health care.
Infrastructural rot. His Excellency, the Governor, embarked on Operation Renovate 305 primary health centers. This Operation Renovate 305 primary health centers took place, of which about 230 of them were renovated. Currently by the former IMC chairman. So we have about 230 of them
in the various communities.
In various communities. We still have about 65 health centers to be renovated. Which, in fact, as at this afternoon rather, we had gotten their account details for the money to be pushed. I must tell you the truth, that His Excellency has not denied the Ministry of Health and these health centers any money that is required for their renovation. I must tell you the truth. I'm sure most of the journalists will want to know how much, but I don't have it by heart. And I must tell you that every single money, even for this 65, is ready. So I will also implore, because the onus is on the journalists. We are all stakeholders in this whole thing. It is not a government thing. Government cannot do it alone. So all of us need to be there. So currently, we have renovated about 230. We have 65 to go. That should give us, no, 240, sorry. We have 65 to go. That should give us the 305. That means one health center renovated in each political ward in Imo State.
Wow.
After that, the next stage will now be equipping. Because you must have a place you must equip. So after renovating them, you equip them. We are not building. I want us to bear this in mind. We are not building new structures, but we want to go and see, oh, these louvers are out, we are going to
How about
put
the
them
ones
back.
that the structures are...
Now, if the structures are bad, you know, remember that we have lots of health centers in most of these places.
Okay.
You actually check, is there any other health center that is good enough? Because the money to build new ones, I must tell you, is enormous.
Okay.
So we must bring back to life at least one health center in each political ward.
Those health centers, are you going to assign doctors to the health center?
Now, number one thing is that from the local governments, we are going to send in health workers.
Okay, both pharmacies.
We are going to send in health workers because you have pharmacy technicians that will be there. You have community health extension workers. And then we are trying to do something in that we are going to get doctors from the general hospitals that will be taking turns in these health centers.
Would they be residents in the various health centers?
These doctors might not be resident there, but you have the health workers, some of the health workers, trained health workers, midwives, and they're resident there because most of these health centers have quarters for them to
So
stay.
you won't make any provision for doctors to be residents in...
No. What we're trying to say, the doctors will be resident in the secondary care facility that is closed. So we are going to be mapping out health centers to secondary care facilities.
What do you call secondary facilities?
General hospitals.
General hospitals, okay.
Secondary facilities,
Teaching
general hospitals.
hospitals,
Now, the teaching hospitals are tertiary facilities. Where they cannot handle in general hospitals, you move them to the tertiary hospital. And that's the way to be.
Okay, so I'm sorry I've taken time. I know that my senior colleagues, they have their own questions.
Let me take you back a little. When we were talking about those hospitals, I wanted to ask, I was trying to ask you, some of those substandard clinic hospitals in Minnesota, how many so far have been shut down? We want to know.
During the time of protests, he marched some hospitals in line with what he just asked.
Okay, your question is a different one from what he said. So I'm going to take them one after the other. Now, like I told you, we are doing facility inspections. Once we find out issues, like I told you, we had one that we got reports about. Once we find out issues, we send in. Now, you're a journalist. You are not a medical journalist. But I will tell you one thing, and I'm sure it happens in your own profession. You might be in a place where you are doing very well as a doctor and your colleagues are envious. They will write against you.
Okay.
The onus is on us to be the unbiased referee. We are supposed to go check. I am not going to go deep into what happened in the hospital we checked in Okigwe, because that's not the subject of discussion. But when we check, there is Operation Zero Tolerance to Quackery in these states. If there is quackery found, we are going to close down the facility, shut it down, and then we'll arrest the doctor and then hand over to the relevant body, the Nigerian Medical and Dental Council, to handle. So far, I must actually tell you that we have not, but we are on it. Remember, like I said, there have been many rots. We will gradually clear off the rots. So coming to your question, yes, some general hospitals during Rotas Okorocha were merged, particularly merged but said to be closed down. But His Excellency has looked at it. What is the reason for closing them down? The Geneva Declaration of WHO says that we should get to a hospital that is 30 minutes walking distance or 5 kilometers distance from us. So we are also looking at how best we can get funds to revitalize these hospitals. These governments, led by His Excellency the Governor, distinguished Senator Hope Uzodimma, is after one thing: a healthy state. Because they say a healthy state is a wealthy state. If I'm healthy, you are healthy. We all go to work and we all perform very well. So that's to answer your question, sir. Thank you, sir.
Commissioner, I know that the government has repeatedly professed its commitment towards ensuring healthcare delivery services to the people. And I know that before this time, there was this popular phrase, health at their doorsteps, especially at the grassroots level. Since you came on board, to what extent has the ministry gone to actualize this? And the other one is this: when former Governor Rogers was in office, he claimed to have established at least one general hospital in each local government area of the state. Information reaching us indicates that those hospitals have been taken over by whips and all kinds of processes. Is there anything you are doing to support actualize this promise of health at your steps, and also ensure that the moribund general hospitals established the Rocha regime and are constructed?
Thank you very much. If you had listened to me while I was talking, I think I mentioned everything. Health at your doorstep is as good as equitable and affordable health care. That's just the truth. And that is what we have been able to do with health insurance. That is what we've been able to do with the Basic Healthcare Provision Fund that is taking care of the vulnerable and under 5 and pregnant women that are in our rural areas. So basically, that is exactly health at your doorstep. Now, talking about the 27 general hospitals built by His Excellency, the former governor of this state, Rochas Okorocha. Well, yes, we came on board. We looked at most of those hospitals. I don't know if most of you have gone to look at them. You have an external structure without an internal structure. Most of them. And then some of them were actually given out on concession basis to some places. Example is the military hospital at Longo Binze. That is one. Okay. The Air Force Hospital along Naze Road is second. The American Cancer Hospital at Iho is one. You go towards Olo side, there is a hospital there. Beside it is Merit College of Nursing Services. I think that's in Umuawa Olo. It was concessioned out to, well, it was concessioned. I must not say to who, so it was concessioned. But you know, why I'm mentioning these ones, the one around Olu was concession to our brothers and sisters who are in the US, and they have done very well with it. Okay. In fact, I must say practically that they have been able to pay their moratorium to the state TSA.
Who concessioned it out, sir?
It was concession during the last regime, and some that were actually concessioned had not been in use because some of the people who took it thought it was just something they would take and go in and finish. But the process, the funds to do these things are quite enormous for them. So they are taking it one after the other, and we're also looking at those things and following them gradually. So that is to talk about the 27 hospitals. And I'm hoping that with the government coming in and with the second coming of His Excellency the Governor, where he's looking at public-private partnership, we'll be able to have better healthcare services. See, the reason for this, I must tell you, is His Excellency is thinking about what is called reverse medical tourism. Why take all the money away from Nigeria to India? Why take them to London? Why take them to Israel? Why take them to Germany? When we can do all these things, my brothers and sisters, when you go outside the country, you find out that it's your own brother, your own sister, that is the doctor that is doing wonders over there. So His Excellency has given us a very good working condition, conducive atmosphere. He's doing his best in terms of security and also trying to face the health of the state. And if he does this, Imo State will actually be the new hub for medical tourism. Let me give you an example. Before, you can't do neurosurgery in Imo State. In fact, you will not hear about it. But today, I am proud to tell you that in the southeastern Nigeria, that the Imo State Specialist Hospital is now the center hub for neurosurgery in southeastern Nigeria. That even our doctors are called from all over. We have patients who come from Calabar, from different places, to Imo State Specialist Hospital. Before 2020, we couldn't have done such. So we are trying to reverse medical tourism. And that also, I must say, should speak well of this state, because early this year, end of January and beginning of February up to March, we had the Imo Medical Mission. That the cases we saw, most people, if they had money, would have gone outside. But instead of us going outside, our brothers and sisters who were all practicing in America decided to come in to do it here. They learned from us. We had cross-pollination of ideas. They learned our own style. Those who don't have much, we improvise. And those who had much, we also learned their own style. You know, if you're doing a myomectomy, here we will decide, okay, let's give tranexamic acid. They'll say, oh, let's do vasopressin. Oh, so you are now saying, oh, well, you can also use vasopressin, so the BP won't go so down with vasopressin. Yes, they'll tell you the pharmacology around it. And then you do it. So there we had cross-pollination. All we're trying to do is, if we have a PPP, I must tell you, we are going to have a reverse medical tourism. And with the kind of security situation that is improving in Imo State now, if these things come to play, our IGR will start increasing, because all those monies would have ordinarily taken outside would come back to us in Imo State. Thank you.
Okay, those concessions hospitals, do you have plans to return it back to the state government, or to encourage those people that are currently in position of them to improve on them or something?
Now,
What are your plans
the
for
first thing you ask yourself is, those that are having them, are they keeping to the rules of the agreement?
Okay.
If they're keeping to the rules of the agreement, you mark them good.
Okay.
Secondly,
If they're not,
the question also will be, why did they take them? Is it for their own profit or for the health, to give health care to Imo State? You can imagine that we didn't have oncology treatment, cancer treatment in Imo State. But our son came back from the US and said, no, I'm going to establish a cancer center. It takes a whole lot of money to do that.
okay.
Are you going to say, oh no, because you're on concession, you are going off, go and build your own? If it goes off, can you give exactly that service? So if that service is to the betterment of our brothers and sisters, we will encourage them. But you must play according to the agreement. Because if you play outside the agreement, the government has the right to revoke it. And then, if the government also looks at it and says, no, we can, then we are talking about public-private partnership. We look at partnering with them.
Okay.
It gives us a whole lot of good. So, either way you look at it, it's a win-win situation. Bear in mind that everything is not government.
Yes.
The goal of everything is the people. It's a win-win situation for our people. And so we'll go on with that. Yeah.
Okay, so, Safin, do you have another question? Okay. Stanley, no. Okay.
Let me begin by commending the Honorable Commissioner. Look at this impediment. Looking at the options of probably partnering with international organizations, but we do know that from time to time the WHO and their partner agencies, they roll out programs that states under the member nations of the WHO, the UN, can actually keep into. In recent time, we have had this campaign against maternal and infant mortality. Has the state been able to partner with international organizations in this respect, as a way of overcoming the challenge of financing?
Thank you very much. And I must tell you that we have a very robust platform where all the implementing partners are working hand in glove with the Ministry of Health and with district governments. The WHO has been very supportive with lots of things we're doing. And I must tell you, if you got the address of the World Rep of WHO in Nigeria on the 4th of May during the flag off of the Basic Healthcare Provision Fund and the formal sector health insurance scheme, you'd actually see that they took note of all the achievements of His Excellency and they gave him kudos and promised to stand with us, even in the health insurance. So we are partnering very well with them. We are partnering with lots of other implementing partners such as Emirates, KCV, the Vitamin Angels, Caritas, lots of them. You also see that during the COVID-19 vaccination, we needed the 70% population that are within the vaccination age group to be vaccinated. It was not what just the ministry could do. The implementing partners came and stayed with us. So we had this with the US CDC, we had this with the US CDC through Caritas. You understand? We had Emirates, you say it through Emirates. who helped us, and we got to the not so reachable areas, because those areas are those places that are security people were averse to going to because of security issues. Yeah, had to reach areas, and we were able to vaccinate people. We were able to get, and I must tell you the truth, I will give kudos to your state because we hit the 70% and we surpassed it. Okay? So that is what you get. Because with financial constraints, you live with the government will be overburdened. They were just implementing partners, getting grants from all these places and coming to Imo State to work. One thing I must tell you people is that we don't in Imo State, we don't ask them, bring your money and give to us. We ask them for one thing, but show us your projects, show us your work plan. If your work plan is in tandem with our annual operational work plan, we move on with it. You finance and we implement. And most of those implementations are done through our agency that ought to implement it, the Primary Healthcare Development Agency, through the Executive Secretary. It comes from this office and down.
From your own calculations, whether the ministry under which you are in charge has done well within this period of 4 years, and what 5 areas would you say that the ministry has, succeeded?
Commission that touched over 3,000 lives is enormous, reverberating. The primary health care in the states, not just renovation, but even the activities of primary health care, has been well sponsored by this government, and that they are touching lives. The health insurance is moving. Now, I must tell you that formerly we had a federal medical center, but today we have a federal university teaching hospital, courtesy this government, of which the implementation committee, I represented the government in it. We have the Imo State Specialist Hospital that has been departmentalized into a real specialist hospital than what it was. We have the medical students that have graduated. This is wonderful. It is touching homes. Even those who are not partisan politicians, it is touching them because their kids are all there. My dear brother, we have these 2 schools of midwifery that were closed down for over 11 years that have been opened. They've started studies. Our mama and Abombise. We are every year graduating nursing students from the Imo State College of Nursing Sciences. My brother, a lot I can mention. A lot I can mention. Today, if you go to the cold chain, we have a new working cold chain that was brought to us through the National Primary Healthcare Development Agency, from the National Primary Healthcare Development Agency through UNICEF. These are all achievements from this government, from this ministry, by His Excellency. I am proud that I am here. I am proud that we have done these achievements. My dear brother, more will come. We are Oliver Twists. We are Imolites. We will ask for more. But before we ask for more, I got Ekelonyaki the Kokoto also. Thank you very much.
Okay, so,
in addition, what has been your greatest headache since you are joined office here as the commissioner in charge of this ministry? What has been your greatest challenge?
My greatest challenge has been to meet up with successes. My name is Success, my son name is Prosper. I've never taken failure for an answer. 2 superlatives I don't joke with. So my greatest challenge is meeting my targets. There was something that was seen amongst all the doctors. I was chosen to head this ministry. His Excellency must have seen something that would make him say, go in there. I must tell you that I've enjoyed the best of cooperation from all the health workers, from my ministry, from all the agencies, all the hospitals under me, all their heads, the best of cooperation. The best of cooperation since I came in. So what is there? There is a reason why we must be there, why we are here. And my greatest challenge and headache is meeting that target. And well, it's the headache that comes with a smile at the end.
Okay, sir. The prevalence of drugs, and all those things. What are your plans to either stop it, both those selling and those taking?
Okay.
What are your plans for all of this?
When you talk about drugs, don't just say Mkpurumiri alone.
Okay. Drug abuse, general drug.
Substance abuse is something that we must drive home. So we start from sensitization to real clamping down to everything we are supposed to do.
Okay.
We are collaborating with NDLEA. And I must also say that I give kudos to Dr. Lina Okereke, who is also championing on her own, from her office, the Office of the SA to the Governor on Health, the war against drug abuse. So we're all doing these things. These are our children. We are not going to kill them. But we need to sensitize. We need to preach to them. It's just like salvation. Some will accept, some will not accept. But all we know is that the level when Mkpurumiri started came out, the level at which we had them, the Oncolos, the Colorado stuff, is actually dwindling now. Okay. And I give thanks to NDLEA. June 26th is Drug Abuse Day and International Drug Abuse Day, and I ask you guys to be part of us as we also speak to the media about it and encourage our children to stay out of it. Thank you.
Okay, sir. Thank you so much. No, okay. So I believe we are all good. We really want to thank you, Honorable Commissioner, for your time. On a short notice, you attended to us, and I know I appeal to you to always keep your doors open for us to still come around. We are Oliver Twist as well. Thank you, sir. And that's the end of the program. Thank you.